Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the President and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to Bristol Health Cares. I am Kurt Barwis, your host, and we are recording this from the Nutmeg studios, the amazing high definition digital studios that Nutmeg has. And I'm here today with Dr. Gosselin, and Dr. Gosselin and I are going to talk a little bit about Heart Month, which we're in right now.
We are, yeah. Everyone thinks of February as African American History Month, which it obviously is, but it is also Heart Month.
Yeah.
And that has been a thing for quite some time now. The American Heart Association, which is actually in its 100th year, they were founded in 1924, founded the first Heart Awareness Week in 1947. So that was 77 years ago. And at that point, it was just 1 week. In 1964, Lyndon Johnson, who himself was a heart attack survivor, issued a presidential proclamation that February would be Heart Month. And so now it went from a week to an entire month, even though it's the shortest month on the calendar.
As you're saying this, I was just processing 100 years ago, and Bristol Health is now 103 years old.
That's right, yeah.
And I'm kind of picturing a lot of what happened back then, you know, like the Spanish flu pandemic and all these other things. And it seems like a long time ago, but it really wasn't in terms of, I think, what we've been able to accomplish. So much of what we've accomplished in cardiac care while we had the awareness, but the advancements just seem to be happening every day anymore.
Absolutely. We continue to learn every day. Cardiologists and other physicians, epidemiologists are conducting trials every day, and we learn more about people's risk factors and how they influence overall heart health. And the American Heart Association is integral in those efforts, as is the American College of Cardiology, which is the more scientific organization. The American Heart Association has really, over the past 50 years or so, actually 60 years since American Heart Month came out, has focused a lot on public awareness and just trying to get the message out there and, let people know that heart disease is such a major contributor to our public health. And the treatment of heart disease has made a massive difference in terms of increasing the overall life expectancy of our population.
So it's Heart Month, Heart Awareness.
Yep.
So how does, what are the key messages in terms of what people should be thinking about to live a heart-healthy lifestyle?
Yeah, so of course, we always want to make sure that people know what they can do to minimize their risk, and that starts with knowing what your individual risk is. If you have the risk factors that we think of for developing heart disease, the traditional risk factors are smoking, the presence of diabetes, high blood pressure, high cholesterol, obesity, and a strong family history. Now, obviously, some of those things you can't control. Your genetics are what they are.
Yeah.
That's the hand that you've been dealt. But doing things with our lifestyle can improve all those other risk factors. We can watch our weight, we can be active, and we can watch our diets. We can quit smoking if we're smokers, and that will improve all those other risk factors and minimize our overall cardiovascular risk.
Yeah, so I saw recently something about they changed the guidelines for smoking in terms of how often you get checked. They actually said that it used to be like they counted pack years and stuff like that,
Okay.
they changed the guidelines, but it seems like any bit of it increases your risk. And even if it was 20 or 30 years ago,
Yeah.
you still have to be aware of that.
Yeah, I mean, to some degree, yes. Absolutely, even if you quit smoking 30 years ago, your risk is still somewhat higher than that of a non-smoker. But the converse of that is the day a smoker quits smoking, their cardiovascular risk drops by about half.
Is that right?
Yes. So,
Wow.
While we don't want you to start doing it because it's obviously placing you at increased risk, we certainly don't want people to be thinking that, well, it's too late for me now, it doesn't matter what I do. You can't teach an old dog new tricks. I hear that all the time. I've been smoking my whole life.
Yeah.
I've been smoking for 50 years. I can't quit. You can quit. It's hard. It's not easy, but you can quit. And if you do, it will reduce your risk significantly in the short term and in the long term. So even though that risk doesn't go back down to what we would consider baseline otherwise, it still improves.
So you talked a little bit about high blood pressure, right? And so, you can go into the pharmacy or the store and you can take your blood pressure. And I mean, how important is it that somebody takes their blood pressure other than when they go to their primary care physician or someone else? And is there some, age guidelines to say, hey, you're 50 years old, you ought to be taking it once a week?
Yeah, I'm not sure that that's really necessary. I think it's very helpful to kind of know where you're coming from, obviously. And then for some people, they may need to take it more. If you don't have high blood pressure, if you've seen your doctor and you know that your blood pressure is normal, like I don't have high blood pressure, I don't check my blood pressure, and I think that's fine. I'm going to go see my doctor for an annual appointment next year. And if my blood pressure is high, then that will send up a flag that, I need to pay more attention to this.
Mine just gets high because I'm in the doctor's office, I'll just be honest.
And that
with you.
happens
It's just
too,
usually, and then they
absolutely.
wait until I relax when I don't think they're going to take it.
Right. And so for someone who has white coat hypertension, right?
Yeah.
Absolutely, it's important to check it occasionally at home because every time you go to your doctor's office, your blood pressure is going to be high.
Yeah.
And so the only numbers that we have to go by are the numbers that we have. And if the only numbers that we have are your numbers in your doctor's office, then guess what? You got high blood pressure and we need to do something about it. But if you can prove that, look, I check my blood pressure every couple of weeks or whatever at home, and it's always 120/70, my blood pressure is fine, we know your blood pressure is under good control.
Yeah.
And then even if it's 150/90 when you go to your doctor's next month, you can say, hey, look, these are what my blood pressure readings look like. They're fine at home, and your doctor will undoubtedly be comfortable with that, knowing that your risk is controlled. So.
Yeah, so it's, if I kind of go back to where you started, so it's being aware of whether you are at risk or have high blood pressure, and if you do, then measurement and tracking it is very important. Because it'll help inform your cardiologist or your primary care physician as you're kind of navigating through that.
Absolutely, absolutely.
So how about diet? How much does diet play into?
Diet plays a big role, both directly and indirectly, okay? So for blood pressure specifically, some people are what we would consider salt-responsive hypertensives. So if they have a salty meal, and the next day they might notice that their ankles are a little puffy, their blood pressure is higher for several days afterwards. And so for those individuals, it's very important to minimize their sodium intake, to keep it less than 2,000 milligrams a day, which if you start counting, looking at the labels and adding up the amount of sodium in your diet, it's shockingly easy to get to that level. And obviously, apart from the more direct impact on blood pressure through sodium consumption, just general healthy eating, limiting our caloric intake, that sort of thing, helps to control our weight, because weight obviously is an indirect risk factor for most of the things that we were talking about in terms of risk factors, right? If you're overweight, that's going to increase the risk of developing diabetes. That's going to increase the likelihood that you have high blood pressure. That's going to have negative impacts on your cholesterol profile. So healthy eating is going to have both direct and indirect effects on your overall cardiovascular risk.
So I'm curious about the salt one, because I have one of those individuals in my house, and I read all the labels, and it is scary when you see how much sodium can be in, well, especially soup, for example. Sure. Soup can have, you can have 1,000 milligrams of salt. You're halfway there for your daily number. Yep. But it's kind of, what I haven't quite figured out is, the why. Like what, you mentioned that it could be like a genetic thing that it causes, it's water retention. And so you build up this water retention, the swelling occurs, it's very uncomfortable. Is it a genetic thing, or can it be caused just because something else happens in your diet, your stuff?
Yeah, I think it probably is more of a genetic predisposition. The people that are more salt responsive, so to speak, that's just the way God made you kind of thing, and it is what it is. But again, other individuals, it doesn't matter so much the sodium that they'll consume. Their blood pressure will either be fine and they're consuming 5 grams of sodium a day, or their blood pressure will be high even if they're trying to really watch their intake.
So how about, because I noticed like people sometimes after they have like a CABG procedure, or they have, some kind of heart surgery, it's like a switch goes off, and all of a sudden that salt just does exactly all the things that you said.
Right.
In a small amount. Is there a rationale for that? Like, so people that have had heart procedures, maybe aortic valve replacement or something like that, are they higher at risk for retaining fluids and salt?
They're not really. Again, either I think you were genetically predisposed to having that predisposition or not. The surgery itself, or the history of a previous heart attack, isn't necessarily going to turn you into, like, flip a switch and make you a salt responsive individual. I don't think there's any data to prove that that's the case. That said, when someone has a cardiac event, be it an operation or a heart attack or something like that, they tend to be more aware of things afterwards, and they're paying much more attention to their overall health, and certainly blood pressure and whatnot. And so there may be a little bit of a selection bias there that may make it seem like there is. So.
Yeah, that's great. That's great information. So how about exercise?
Exercise.
One of the other ones that you mentioned.
Absolutely,
really high
exercise is the other side of the seesaw, as I like to say. You can't have the diet without the exercise, or if you do, it's making it that much harder, because the two are kind of integrally linked. When the more active we are, the more calories we burn off with exercise. It kind of increases our overall baseline metabolism, so that we burn off more calories at baseline when we're routinely active, and that helps so much with our management of our weight and our other risk factors. That exercise is absolutely something that we always recommend. Younger individuals obviously kind of associate exercise with going to the gym and going on the treadmill or the elliptical, or doing your circuit of weights or whatever, and that's all great. That's all fine and good, but it doesn't have to be that. You don't have to be training for a marathon to be getting exercise. Even as we age and we're a little bit less active than we were 20 or 30 years before, it's still important to just keep moving, just stay active. And some people during the winter months will go to the mall and go for a nice walk around the mall for a half hour or 40 minutes, and they're getting their exercise that way. Even if you have a treadmill in the basement of your house and you do that 4 or 5 times a week for a half hour or 40 minutes, that all counts. And we recommend, if you go by the American Heart Association's guidelines, we always recommend that people be getting 5 days of moderate cardiovascular exercise for 45 minutes per session. But if you're not hitting that number, it doesn't mean that you're doing nothing, So
just because you can't get 45 minutes in because maybe something's going on,
yeah.
any 20 minutes works.
Absolutely. 20 minutes is certainly better than 0 minutes,
I wasn't born and raised in Connecticut, but I got to tell you that, when I walk the trails, the Farmington Trail and other places that are just gorgeous.
Yeah,
and
absolutely.
I find myself really getting more centered. So there's this holistic impact of, even if it's not on my bike or it's walking or taking the dog out, I feel better. I feel refreshed, fresh air.
Yeah, it's good for you mentally.
Your houses are closed in the winter. So,
right. Bundle up, get out there, go for a walk, right?
Yeah. So how about impact of alcohol, wine on heart health?
Yeah. So there's always been this mantra that light to moderate alcohol consumption it provides some cardiovascular benefit and is actually cardioprotective. Heavy alcohol consumption absolutely is not. That has negative impacts in terms of the pumping function of the heart if people are excessively drinking. And it can also increase the risk of heart attack. Probably a glass of wine a day is okay. And again, there was data over the past several decades that has shown that may decrease the risk of cardiovascular events to some degree. I think at this point there is a little bit of data to the contrary too, and the jury's out a little bit.
Yeah.
I certainly would not recommend that people start drinking if they're not drinkers, for the cardiovascular benefits of that. But again, if you have a glass of wine with dinner, I think most cardiologists would tell you that that's okay, and you can continue to indulge in that level of consumption.
Yeah, you look at worldwide, they have those areas called the blue zones where people live to be 102, and in just about every one of those that I'm aware of, they drink red wine. I don't know if the grapes or the whatever that thing that's supposed to be good for you is higher content over there, but but then the other key attributes of what they consume is olives, olive oil, fish.
Sure,
fruits
there's a lot
and
of different factors, a lot of different variables there. Yeah.
And then there's also the environment itself, which can be a big contributor to longevity. But anyway, it just seems like I think paying attention. It sounds like paying attention to it. Being balanced.
All things in moderation.
Yeah, it is what's going to help you live a long life. So that's really positive. Yeah. So Heart Month is really a time, and I mean, obviously, it's Valentine's Day is coming up next. Right. So don't forget about, I know this could air after Valentine's Day, but we can't forget about Valentine's Day. 14th. It's the 14th, right?
It is
wow,
the 14th,
I wouldn't make that mistake. So it's kind of neat that Heart Month is the same as Valentine's Day. We associate.
I don't think that was an accident. I think they planned it that way. Yeah.
So which do you think, which came first, Valentine's Day or,
Valentine's Day came first.
Came first, and they picked February. So, okay, so that makes sense now.
In terms of its emergence as a Hallmark holiday, I don't know about that.
You're right.
But certainly the American Heart Association has really increased their efforts to kind of get the message out around this time about how people can reduce their cardiovascular risk. One of their newest big initiatives, it's not so new anymore. It was 20 years ago, 2004. Was the launch of the Go Red for Women campaign. And Go Red for Women Day is the first Friday of the month. So last Friday, February 2nd, also Groundhog's Day, was Go Red for Women Day this year.
I think he saw his shadow, is what I read.
Yeah,
he saw
right,
his shadow. So we're going to have an early spring. That's good
yeah,
news.
but that said, he's right about 40% of the time, I think. So I wouldn't put the snowblower away just yet.
Yeah.
But Go Red for Women Day, it was kind of a reaction to the old kind of theory that heart disease was a disease of men. You'd hear in the 60s about how heart disease is a killer of men, and men would have heart attacks, and you didn't hear much about how it happens to women too.
Yeah.
And some of that may be because the population is aging and our life expectancy has increased. Because before menopause, the likelihood of cardiac events in women is lower, significantly lower. But once women hit menopause and exceed it, they quickly catch up to men. And so the Go Red for Women campaign was designed to kind of get the message out that this actually does affect women too, and it's very important. And actually, they have kind of shoehorned some guidelines or recommendations into the Go Red acronym. So GORED, right?
Yeah.
The G in Go Red is get to know your risk factors. And so that means knowing your blood sugar and your cholesterol and your blood pressure. The O stands for own your lifestyle, which means if you are a smoker, quit smoking, try to get more exercise, watch your diet, and take ownership of your risk factors. The R stands for realize your risk, which means that for women, they should be aware that 1 in 3 women will die of cardiovascular disease, either a heart attack or stroke, which is the leading cause of death in women, which is greater than all forms of cancer combined. The E is educate your families, which means obviously tell everyone in your household and daughters or whatever that this is a thing that we all need to be aware of and be concerned with. And the final D is don't be silent. So not just educating those in our households, but also talking to those in our community, and again, getting the word out.
Dr. Gosselin, you get like an A++ for being able to actually go right through that and know every single part of it. I mean, that's incredibly impressive. And so we have a minute or so left. What message would you like to kind of send to the viewing audience about Heart Month, other than what you've told? I mean, what would the key thing to say to people be?
Sure. I would say that the key thing is that we should all be aware of this, and that we all can take some ownership of this. There are some things in life that we can't control, obviously. And hey, look, there's really no reason to stress about things that we can't control. But in terms of cardiovascular risk, we can control a lot of it. We can't control our genetics, but we can control our lifestyle. And from a very young age, trying to take advantage of what we know, what medical science has taught us over the last 100 years, just taking some personal responsibility for how we want to live our lives and how we want to be healthy for our lives is very important.
That's great advice, Dr. Gosselin. And you can reach him at our medical center on Riverside Avenue. He's got his office there, and any member of our cardiology team. They're extraordinary. So thank you for visiting with us today.
Thank you for having me.
And
thank you to Nutmeg TV.
What an amazing advice that you gave the viewing audience. This is Bristol Health Cares, and I love to cover topics that are important to you, of interest to you. You can write me at cares@bristolhospital.org with your suggestions and ideas. Special thanks to Nutmeg TV, this amazing, high definition digital studio. You see this pillow here that said subscribe. The good news is it costs nothing to subscribe. You can pull down that app on your Android phone or your Apple phone and load it on your phone and watch episodes for free. And you also can get it on all of your streaming, whatever streaming service that you subscribe to. Please support Nutmeg TV with your viewing eyes, and also, if you can, support them with your donations. It is a completely nonprofit organization here for the benefit of the community, the surrounding community, and it's a great asset that we have. So this is Kurt Barwis, President and CEO of Bristol Health, signing off with Bristol Health Cares. Until the next time, be healthy and listen to this amazing advice you got from Dr. Gosselin. Thank you. Take care.